In my opinion, the patient voice becomes more and more important because even the politician or the stakeholders itself, they believe more in the patient's voice than in the physician or the other disciplines. And for my opinion, it took much too long to include the patient advocates. But it's still to explain what's the difference between a patient advocate and a patient supporting group. And this is not in the mind of many physicians so far, because they still think, they are caring for patients and they're doing some meetings or so. But we found out, and I have to be a little critical, our Patient and Family Day on Saturday, just before the beginning of the EBMT, was not a Patient and Family Day. It was more a nurses' education day than it was really for patients. It was too much technical, shown, how you harvest your bone marrow or your stem cells, how the registers are. A patient don't need to know it. A patient wants to know what is after my transplant, what do I have to care for, how can I get help for different things like the long-term GVHDs in different kinds. So I think we have so much to do to also convince the transplanters that we even can help them really to focus of what the patient needs is. I think each transplant center should be in touch with patient organizations. And to my opinion, it doesn't make any sense to bring to an European Congress the local groups. So I think every country should do it in their own country, in their own language, because you have to bring the message to the patients that they understand what's going on. And because many patients, when they are after transplant, or even if they are under chemotherapy, they have cognitive problems, so even the translation will exhaust them because listen in their own language and listen to the translation to the same time is not possible for many. So I fight for, and I want to mentoring this program to many others, and I already had success in a few countries, so that each country does their own Patient and Family Day after transplant, because then you can really focus what the need is in your country. And even if you do it in several cities in your country, it's much better than to do it only on a European way. So for example, Saturday we had 5 or 8 patients, but for 200 attending people it was nothing.